Welcome everyone, and thanks for joining. My name is Roy Ozeri, and I'm the Vice President for Development and Communications at the Weizmann Institute. We thought that it'll be great to come back to the topic of COVID and hold another seminar for all the friends of the Weizmann Institute worldwide. You know, the last 2 years, all of us have been occupied very heavily with COVID. Weizmann Institute was no different. In the last 2-3 months, in the entire world, and Weizmann Institute included, went through the Omicron wave. This was a huge wave all over. Here at the Weizmann Institute, we had very high infection rates, close to 30 infections a day. I myself got infected and spent a few days in quarantine at home with COVID. So even though the number of infections on campus during this Omicron wave integrated was much higher than the infections, all the total infections we had throughout the previous 2 years, the Weizmann Institute hasn't stopped. And I think that the reason for that is that I think all around the world, and in Israel in particular, it was very clear that the Omicron disease was not as dangerous and not as severe as the previous waves of COVID. And that's why the restrictions we had on campus were not as severe. And the activity on campus did not slow to a halt. I have to say that both in Israel as well as the Weizmann, almost all restrictions are over. I think that besides wearing a mask, practically we don't have any restrictions. Conferences are back, gatherings are back. All scientists receive invitations to travel to conferences abroad. We went back to organizing conferences on campus. And really the atmosphere here is that, and the feeling is that COVID is behind us. And I think that while this is the feeling, it's very difficult to judge whether this is a psychological effect of people having a feeling that the worst is behind us and we're back to normal, and we're facing another mutation, another variant that would flip the coin back again and we'll be back to restrictions, or this is an actual epidemiological fact, and this whole COVID episode is behind us. And this is the reason why we thought of inviting Professor Gabi Barbash, who has already held several such seminars, in particular at the beginning of the epidemic, to bring Weizmann friends knowledge and facts about this epidemiology, to come back to us and maybe try to lighten our eyes with respect to the situation that we're facing now. So with this, I'd like to introduce Professor Barbash. Gabi Barbash is an MD and MPH. He's the Director General Emeritus of Israel's Ministry of Health and the Director of Weizmann Institute's Bench to Bedside program, which brings together scientists and physicians studying and developing therapies and other solutions to the disease. He's a professor of epidemiology and preventive medicine at the Sackler School of Medicine at Tel Aviv University, and was formerly the CEO of Tel Aviv Sukarsky Medical Center, also known as the Ichilov Hospital. So since the pandemic began, anyone in Israel who have seen the news broadcast of Channel 12 has seen Gabi frequently bringing knowledge to the Israeli public. I think Gabi's contribution to the way that Israel has coped with the disease is invaluable. So thank you very much, Gabi, for being willing to come here and speak with us tonight. You're invited to submit your questions in the chat or to the email vip.visits@weizmann.ac.il. And following Gabi's presentation, Tamar Levin, who is the head of our resource development department, will run the Q&A session with Gabi. So with that, Gabi, please, the virtual floor is yours.
So thank you, Roy. for inviting me. With the declining pandemic, I am kind of screen deprivation, so it's good that I have another screen. In my short talk today, I will discuss 3 topics. First, I'll begin with what we call the COVID Enigma. Then some of the lessons that we have learned here in Israel during the Delta and Omicron waves. And finally, where are we heading? So let's start with the COVID Enigma, what I call COVID Enigma. We are 2 years into the pandemic, and we still do not understand why some people don't get infected despite being exposed to the virus. How can we explain a married couple that live together, eat together, and even sleep together? The husband is sick, going into ventilation for 2 months with 3 resuscitation, and the wife is completely healthy. Well, there are 2 potential explanations to that. One is genetic protection against infection, as we also see in some other infectious diseases. Actually, there were about 20 genes that already were identified that kind of defend against corona infection. But there is another possibility, which is cross-immunity from the other 4 endemic human coronaviruses that stimulated some long-term immunity or immune memory. In a way, this cross-immunity is also our hope for the resolution of the COVID pandemic, and we will return to this positive note at the end of my talk. Now, let's discuss now Israel's experience with the vaccines and the boosters. Evidently, pandemic management has changed dramatically before and after the introduction of vaccines. There is no question that vaccines are our only way out of this pandemic. Of all the COVID prevention measures that we have at our disposal, vaccines are far and away the most effective at reducing the risk of hospitalization and death. Now, let's elaborate a little about the Delta wave dilemma and the role of boosters in its resolution in Israel. When the Delta wave arrived, we were not sure about the balance between Delta variant resistance to the vaccine and the waning of vaccine immunity. Which of these was more dominant? Indeed, in the beginning of the Delta wave, we saw many breakthrough infections among vaccinated people. This raised the suspicion of variant resistance to the vaccine. And this is something that we were worried about since the beginning of the pandemic. However, given that the most of our population at that time had been vaccinated, it was expected that vaccinated people will also have a higher representation among the infected individuals. However, when we started analyzing the correlation between the risk of being infected with the timing of the initial vaccination, we started seeing an interesting picture. There was a clear correlation between probability of being infected by the Delta variant and the time that has elapsed since the second vaccine dose. This was a revolutionary observation coming from Israel. While we all knew and we estimated that the vaccine will be effective for a limited time, no one thought it would be as short as a few months. US public health officials didn't believe this initial impression from Israel. I was part of the team that analyzed the data. I remember I had arguments about this with Tal Zaks, then the chief medical officer of Moderna. And I remember one Saturday in July, waiting for Shabbat to end to let Bennett know we received the final definitive results that proved that it was not the Delta resistance, but the waning immunity, and that we should deliver the 3rd booster. We would be the first in the world to do so. There is no question that the 3rd booster vaccine saved Israel from a disaster associated with the Delta wave. It is worth mentioning, though, that recently we observed the same waning immunity of also the third booster with regard to the Omicron wave. Israel's healthcare system, its 4 HMOs, and their excellent clinical databases won worldwide recognition for this expedited clinical observation. By now, we are all aware of the 2 characteristics of the Omicron variant. Firstly, it is highly transmissible and therefore spread very fast. Secondly, it is associated with less severe disease, fewer hospitalization, and lower mortality. However, despite this observation, I am not sure that the Omicron variant is indeed significantly less virulent as compared with the previous ones. 2 recent studies estimated that Omicron was about 75% as likely as Delta variant to cause hospitalization of an unvaccinated person with no history of COVID infection. This means that the Omicron variant causes similar intrinsic disease severity as previous variants. I believe that the observed reduction in Omicron's virulence stems from its greater ability to infect people with pre-existing immunity, which protects them against severe disease. We recently witnessed a worldwide steady takeover of the new Omicron subvariant BA.2, based on places like the UK, South Africa, Denmark, where there is an increasing proportion of BA.2. I do not think we are going to have a significant BA.2-driven outbreak. The BA.2 variant may slow the decline in infection, but not dramatically. One more point I wish to raise regards the question I am being asked quite often lately. What is the implication of a positive antigen test after the required quarantine period of 5 to 7 days? It is important to understand that not like the PCR test, which may occur long time after COVID infection because of viral remnants in the upper airways, positive antigen tests may indicate that you are still potentially infecting others. Indeed, there is accumulating evidence recently that infectious period of the Omicron variant is longer than the 5 to 7 days of the formally required quarantine. And finally, I would like to emphasize again one critical fact or truth. Nearly two years into the pandemic, the unvaccinated are still making up the majority of COVID deaths. Only a small percentage of deaths are among fully vaccinated and boosted people who are either older or have pre-existing conditions that increase their risk of dying. So here I concluded what I wanted to tell you about the past. Now we are reaching the more riskier part of my talk. Where are we heading? So obviously, clearly, we cannot eradicate the COVID virus. It is too widespread and our vaccines are evidently imperfect shields against it. Also, there is no question we will see new variants. Now, is there a reason to think that the next variant will also produce less severe disease like the Omicron, or is it wishful thinking? The answer, I think, is yes, but let me explain why. Firstly, I'd like to share with you a recent analysis of the last few days we ran here in Israel. So here you can see the number of new infections or the number of total infections per each of the waves that we experienced in Israel. You have the last 3, which are Alpha, Delta, already with name, and Omicron, which is the higher, bigger wave. May we see the next slide? And then you can see where we put the vaccines in the 3rd wave, and then the booster in the middle of the Delta wave. And now let's look what happens with mortality rates in those in those 5 waves. So you can see that the first wave, which was a small number of infections, but the mortality was close to 2%. Already the second wave, it went down to 1%, and then down till the Omicron, where you have 0.08% mortality. Now, I have to draw your attention that there are here 2 opposing biases, because firstly, for sure, the number of infections was higher than what we counted. And on the other hand, we haven't seen all the deaths that are related to the Omicron wave. So these 2 opposing biases are kind of balancing each other. Clearly, you can see that the mortality rate is going down across the different waves. Now, what are the explanations for that? For sure, vaccine has an impact here, but also better understanding of the pathogenesis of the corona disease, with understanding what is the immune system contribution there, and the treatment with steroids, which change dramatically the outcome of those patients. You can take out this slide now, please. So now, but there is an additional factor that we have to take into account when we try to understand why the mortality is going down. And I think we have gained some degree of protection against new variants, and we may have less severe disease from now on. This protection comes from the continuing increasing population immunity, resulting from either vaccination or infection. This is very similar to our experience with COVID's more distant evolutionary cousins, the 4 other seasonal or flu coronaviruses, which we have all gotten and not really cared about. These flu corona variants are far older than the COVID variant, and they have been circulating for centuries. We believe that at some point in history, these 4 flu variants or viruses invaded populations and initially caused devastation before reaching what we call a state of equilibrium with the population. Now they are endemic and infect most people when they are young, causing mostly mild infection. So to sum up, I am cautiously optimistic that at some point this COVID-19 will also behave or evolve in a way that is similar to the seasonal coronaviruses, which are endemic. And finally, I think that corona-wise, excluding Ukraine, this spring will look a lot better than the winter. Thank you.
Okay, so we'll jump into the questions. So Gabi, this is for you. Do you think there will be a vaccine that works against all coronaviruses?
I don't know. I know that they are talking about that. They are thinking about that. The advantage of mRNA vaccines is that they can include in the same envelope a few variants. I don't think what they have now is going to answer all coronaviruses, but it can sure take care of a few variants of the COVID-19 together.
Okay, so what has Israel learned about the efficacy of the 4th vaccine?
The 4th vaccine was very efficient and helped us deal with the Delta variant. And I think it was good for the time. I saw questions here whether we should take a 4th booster now. And I think that the answer to that is not clear for everyone. For example, in Israel, since the Omicron is going down, I would hesitate to recommend to have a booster now. But if it would have been a month earlier, I would have strongly recommend, yeah.
When did you have your fourth vaccination?
I took it as soon as they allowed it.
Okay, so what would happen if a more severe variant surfaces?
I think, first of all, we do not know. Here is green campus and the black screen. Yeah, hold on.
Okay, so what is the best guess of if and when we might need additional boosters?
Did you explain the policy here? Yeah. Okay, I'm back.
Sorry,
What did you ask?
can you hear me? Okay, what do you think, what's your guess if we're going to have more boosters,
Okay, if we have,
boosters?
you know, look, no one knows. The next variant can be very similar to the Omicron, and it can be very, very different than the Omicron. We do not know. I hope that the theory I presented here is true, and the fact that we have accumulated long-term memory, immune memory in the population because of the vaccines and the infections that were very spread with Omicron, it will give us some shield against new variants, but really no one knows.
Yeah, it's okay. So now that restrictions were removed, are we safe to go into indoor gatherings? Do you go into indoor gatherings?
I am not yet. I wait until the infection rate is going down to less than 100. And whenever I'm going to a gathering in closed space, I'm with a mask. That I think masks are going to accompany us for a long time.
Yeah, are going to stay with us.
And they are very efficient.
Of course. So there's another question about your advice to keep distance, which I'm sure we know your answer.
Yeah.
What distance? I mean, do you know, now that we know the size of the virus and everything, what distance should we keep?
It's not mathematics. You know, we are dealing with biology, and they say 2 meters. Look, if you are with a mask, a good mask, you're okay.
Okay, so many questions now are about, should we keep wearing masks? So you've answered that. So the answer is yes, we should be keeping masks for a long time.
Until this is completely over, whenever I'm going to public transportation, closed spaces, I will be with mask. And even if the other guys there are not with mask, I am protected. And I know that for sure.
Okay, we will. Can you please summarize the ill effects of the vaccinations and boosters that have been seen in healthy people?
I am not familiar with that. We know that there are some side effects of vaccines. These are very mild, except for really rare cases. Compared to other vaccines that we have in the history, this is one of the more safer and efficient vaccines that we ever had in the history of vaccinations.
Wow, okay. There's a question here about long COVID. So what has been the trend with long COVID here in Israel, and how is it being addressed?
Okay, long COVID is a phenomena that is not well defined yet. It includes a lot of symptoms of fatigue, heart rate, memory issues, and so on. It is not well defined, but these are effects that we see in about 20 to 30% of those who had infection with COVID-19. There are last 10 days articles or papers, works that were done on people after COVID that were infected with COVID and have shown quite significantly and dramatically an increase in the rate of myocardial infarction, congestive heart failure, and also some mental issues a year after infection with COVID. I would conclude by saying that COVID is not an innocent virus. It is a virus that has significant impact on our immunology system. That's how it works. And sometimes it takes time until you uncover what are the true long-term effects of an infection with COVID-19. And I'm sure we are going to have more data on that in the next 1, 2, 3 years.
Speaking of long COVID, have you seen differences of the long COVID effects between the different variants?
Not that I know of.
Mm. Okay.
Maybe if you see, I'll tell you, it's also one more issue. It's not only variants. If we remember what I talk about, increasing immunity, so maybe when you get a 6 or 7 variant, you are more immune and then you will get less long COVID. So it's not only the variant, it's always an equilibrium between the virus and the host. And if the host is more prepared, immune, then the effect is less.
Yeah, I think this was my case. Okay, so there's some discussion that the 4th booster won't be any more effective than the 3rd. Is there a worry that the next variant will be much more severe? Is it true?
We do not know. And, I can't predict on that.
Okay, so what's your opinion about vaccinating children under the age of 5?
Basically, I think children should be vaccinated. We have a problem with the data on below 5, younger than 5 years old. I would wait because there is not clear evidence to the effect, at least with Pfizer. So we need to wait with them yet. But basically, if we find the right formula with the right dose, it is important that they get vaccinated. Yeah.
So for people who had severe side effects from the vaccine, what should they do about that with future boosters?
Yeah, it depends which side effects. If it is fever and shivers and, that is nothing to worry about and it goes away. But if there is some significant side effect, then there are new vaccines that are coming in, protein-based vaccine, Novavax, so they can use another vaccine. Not that other vaccines are totally free from side effects. This is possible in any vaccine, but at least if they know that they have a problem with one, they could use another one.
Okay. So what do you think about medicine against COVID? Will that be soon found?
Okay, so there are different steps of medicine. There is the preventive measures, which are, it's not a preventive measure, but I'm talking about the Paxlovid, which is given in the first days, and the medication of Merck, which are given in the first days of the infection in order to avoid developing a severe disease or severe infection. And there are antibodies, but now that we have the medications that are given by mouth, I think these are the best to use in those cases that we fear from the risks of infection with COVID-19.
Okay, and a question moving forward, do you think like a flu will have like an annual vaccination for COVID?
I'll tell you, I don't know yet because with flu, they are trying to predict which variant, what are the characteristics of the flu variant that is going to hit next year, and they are planning for that. I'm not sure we will have the same with the corona. I think we are still in the kindergarten in understanding what's happening with that, especially when it relates to immunity that is related to the coronavirus. So I think we have a long way to wait and learn before I can answer that.
Okay, so speaking of kindergarten, we'll go back to children again. So there's another question about children. If giving 1 dose of the vaccine to young children aged 5 to 11, does that give them protection against Omicron? The 1 dose?
Our understanding is that vaccine to kids between 5 and 11 or 11 to 18 is going to confer some immunity. How strong that immunity is going to be, I don't know. But, you know, speaking on my own kids, I would rather have them meet the corona antigen by vaccine rather than having them have that meet the corona with infection. The ramifications are significantly different.
Yeah. Okay. Thank you. Is there an anti-vax movement in Israel, and how is that handled?
There is, and very voicely one. And look, there is no way to convince anti-vaxxers to leave their post. I mean, it's like a religion or cult, and I can't, you know, it's something that we have to live with, and try to persuade those who are on the borders of that cult, which are not convinced by you know, like religion, but just hesitate.
Yeah, we even had a political figure go for that in the elections.
Yeah.
Okay, is there any a preferable brand of vaccine in your opinion?
We do not have enough information on that. We chose Pfizer. Pfizer and Moderna seems to be the best, but evidently they are short-term defenders. So it is interesting to see when other vaccines are going to come into the market, whether they will have better, you know, shield against the coronavirus. We do not know yet.
Okay. Are there any specific dietary supplements beneficial you think you recommend?
At certain time in the beginning of the pandemic, there was some mechanism, physiological mechanism that pointed to the significance of vitamin D in defending, augmenting the immune system. There is no damage in taking vitamin D. I doubt the benefit, but whoever wants to try and take vitamin D, no problem.
Okay. Is there a reason to be concerned about the vaccine's future effects on a little girl's reproductive system?
This was, look, we have experience of 2 years or 1.5 years with the vaccine, and we are, you know, I cannot tell you what happens in 10, 15 years, but there is clear evidence that vaccines are not interfering with the reproduction system, either at the male or the female. Vice versa, when a male is inflicted by corona infection, his reproduction system is damaged for about a month until 3, I mean, can be damaged until 3 months after the infection. So vaccine has no effect on the reproduction system. Disease does have, at least in males.
Okay, good to know. Question, like a general question about Israel percentage being vaccinated and boosted.
Vaccinated about 70%, boosted less. People got tired from getting vaccines, and many of those, close to a few, like 800,000 people that could have got the booster, chose not to take it. So we are left with what took it. I mean, those who took the vaccine, those who took the booster, and another 3 or 4 million that got the Omicron, infected by the Omicron. So altogether we have, I think we got a nice immune defense now in Israel. Not herd immunity, but immune defense.
Yeah, high percentage. Okay. Why we still don't know why the pandemic began? Was it lack of control in China, bad management?
I don't think we have an answer for that. There are many assumptions. Lately, there is a paper on that proves that it is coming from the market. I doubt if we know that anytime. I mean, we will have a clear-cut evidence. I doubt it.
Why does new variant vaccine take months to develop, given RNA technology?
It doesn't take too much. The production takes about a month or a month and a half. What takes time is the research or the test that they do on the population. For example, we have now in Israel, there is a study of Omicron variant vaccine by Pfizer here in Israel in a certain hospital that is being run here. But this takes time until you recruit, give the vaccine, follow up for side effects and antibodies and so on. That takes more time. But if we wanted to jump on, skip the trial and do what we do in flu, by example, because with flu, we do not do a trial every year. We take the vaccine, we give it to a few, hundred of participants that are volunteering, and we look on their antibody levels. If they are increasing, we are releasing that immediately. And this could be the case with coronaviruses, with corona vaccines also, but we are not that yet.
Okay. Oh, okay. So in regards to the slide you showed with the graph, did the mortality also change in kids with kids under 18?
We didn't analyze. First of all, the mortality among kids is very small. So the numbers are very, very small. And this slide is taking care age and male, female. It does take age into that. So, but I can't tell you what happens with kids because there are very small numbers.
Anyway. Mortality was low, which is good. So,
yeah.
So thank you for that. Has mortality in unvaccinated changed? With unvaccinated changed?
I don't know.
I don't know.
I don't know.
Then we go to why the vaccine is not efficient in blocking Omicron contagious.
So the Omicron and the BA2 are very, very infectious, and therefore they are, they evade the vaccine. But you have to take into account the following: the vaccines are doing their work in the immune system of the body, not necessarily in the upper airways where the Omicron and the all corona variants are coming into our body. So you may have a situation where the tissues in the upper airways are not immune against the corona, so they can infect in the nose and the mouth and the tonsils and so on. But when it tries to go like before to the lungs and internal organs, then there it meets the immune system, which are inferred by the vaccines. So the vaccines cannot sometimes prevent infection or transmission through the upper airways because they are not protected, but it can prevent that to progress into coronavirus, fulminant coronavirus disease. That is the explanation.
Okay, thank you for that. And time has come for our last question. So you did say that mortality with kids is of course very low. Any theories around that? Why is that so?
Why?
Yeah.
No, this is one of the enigmas of the coronavirus. We believe that the immune system in kids is capable, probably more capable than the immune system among old guys, old people, elderly. Why is that like that? I don't know. I don't have the explanation. I haven't read something on that yet. But,
okay.
But by the way, it is true also with other coronaviruses. By the way, it is when you are infected with coronavirus when you are young, the outcome of that infection is much more favorable, both in disease and also in creating immunity for the long term of your life. So I think something in the immune system of the young kids is capable of both dealing with that and also incorporating that as a future tool for immune system.
Okay, thank you very much. Any concluding words for the audience, Gabi?
I think that reality does not keep giving us challenges, and when the corona is going out, we are challenged with another very aggressive viral attack coming politically in Europe, and I hope this ends in a better way than it looks like now.
Yeah, we can join you for that hope. So thank you again, Professor Barbash, for taking the time to speak to us today, and thank you all so much for joining us. And I do welcome you to continue to participate in our webinars. But more than anything, we look forward to hosting you again here on our beautiful campus in Rehovot. We really miss you. So have a great rest of the day or good evening, wherever you are, and all the best. Bye-bye.